You're listening to Online Pet Health Podcasts with Dr. Megan Kelly. Continuing education for veterinarian rehabilitation therapists. Learn more at onlinepethealth.com.
Hey Vet Rehabbers, you're listening to the Veterinary Rehabilitation Podcast and I'm your host, Dr. Megan Kelly. So today we revisit one of our Facebook Live interviews. It was a Q&A session with Marinette Teeling from Equine-librium College, which is a veterinary physiotherapy college based here in South Africa in Plettenberg Bay. And we were chatting about respiratory physiotherapy. So it was a Q&A session where people from our community asked some questions which Marinette so kindly joined me and answered. Our online Facebook communities are an amazing place to get support, to ask advice about your cases. So if any of you guys are out there, you want to join, please just search for equine vet rehabbers, small animal vet rehabbers, or hydro vet rehabbers. And just recently now, we've also created the business vet rehabbers. So for those of you that are in business and are looking for some advice and support to grow your business. So this Q&A session involved questions about aspiration pneumonia, brachycephalic dogs, cleft pallets, and also how to get vets on board with doing physio in respiratory cases. I think you guys are going to love this one. Over to Marinette.
So the first one, Marinette, was somebody said, I have a patient that was bottle fed as a pup and had aspiration pneumonia. He's now 2 years old and struggling with a current pneumonia. Any advice on treatment?
Okay, so usually when you're sitting with a pneumonia or something that keeps on coming back from a pneumonia point of view, I think there's three areas that I would focus on. One is we want to get rid of the buildup of secretions. And then two, we want to get more air into the lungs because that'll also help to better the air increase through the alveoli, and then to increase their exercise tolerance. So I think those are the three areas that I would be working with. Now I don't know how active this specific dog is that they're talking about now, or from a breed point of view. Sorry, Megan, I don't know if they said there was no breed on there. Okay.
No breed.
From a secretions point of view, the basics that we use is obviously your postural drainage positions. So depending on which lobe is more affected than the others, you need to position them in either a head down 45 degrees angle, depending on which side, whether it's on the left or the right side, because what we want to aim for is to have gravity help us lead the secretions down to the bronchioles so we can get rid of that. So we normally place them in that postural drainage position, and then we use our different capage techniques. So your vibrations, the shaking. Sometimes we use mechanical vibrators too, because that actually helps a little bit. And we can nebulize the dog beforehand. So I'm not sure if the vet would have prescribed something to help loosen up the secretions. But if he hasn't, and it's something that comes back very often, I definitely get in touch with them to see if we can add something to the saline from a nebulizing point of view. So I'd nebulize them, maybe wait 10 minutes, then put them in a postural drainage position, use some of my manual techniques to get rid of or to loosen up the secretions. And then I would do some form of exercise to try and get more air into the lungs to help with that secretion release. You can also mobilize the costovertebral joints, the ribs, because very often these dogs, because they're coughing so much, they get really tight in that thoracic spine, lumbar spine. So if we manually treat that area from a joint and a muscle point of view, we'll make it easier for them to cough. If the coughs are getting a little bit more painful, and you'll also allow them to get more air into their lungs, which will then help get rid of the secretion. So I would combine those three things to try and get rid of the secretions, because that at the end of the day is really what you're aiming for. And then slowly but surely start building on their exercise tolerance to see if we can get the airs or their breathing rate deeper, not faster, but deeper, to see if we can get more air into the lungs. And I would probably be seeing this dog a good 3 or 4 times a week. So depending on where they live or how educated the owners are, this is something that needs to happen actually at least twice a day. If we pull it back from the human industry, usually if we've got pneumonias, we'd be treating these patients twice a day in hospital to try and get rid of the extra phlegm. So very intense therapy, I think, for the first 2 or 3 weeks to see if we can get rid of it, especially if it's a chronic condition. Then we kind of need to go in, I want to say concentrated, and then slowly start tapering it to see where it goes. Yeah.
Thanks, Marinette. What did you get the owners to do? Do you get them to do you give the owners exercises and things to do, and would you let them nebulize?
For sure, depending on how competent they are, and I think depending on how cooperative the dog is, I would probably show them the position to put the dog in, the postural drainage position. I'd show them how to nebulize. They can very easily rent a nebulizer, but there's some very nice new canine nebulizers that don't make a sound. It's pretty nice, and I think they'll be obviously a little bit more expensive. But for something that's a chronic problem, I'd probably invest in something a little bit more suited to what you want to achieve. So I'd show them how to nebulize, and then with the vet, decide on what kind of medication we're putting in the nebulizer, because you obviously can't medicate them every time you nebulize. But I'd nebulize them 3 times a day. So the owner can do that. I'd show them how to put them in that postural drainage position. And I might show them some of the rib springing mobilization, secretion mobilization techniques to help them get the dogs to breathe deeper. Because if we're in that position with a nebulizer, with better breathing, it'll allow them to cough and get rid of that secretion. So with these type of patients, depending on the competency of the owner, I would actually give them quite a lot to do, and maybe follow up on them on a every 2nd day, every 3rd day basis. Yeah. Unless the dog's sick. If the dog's very ill and potentially compromised, otherwise, then obviously not. Yeah.
Then they're often in hospital anyway, so or at the vet, So I'm going to get on to the next one. One of my clients is a bulldog breeder, and they're involved in rescue. How do you treat or intervene when young pups are already struggling with secretion buildup due to conformation and maybe soft palate problems?
So I think rescue makes it a little bit more complex, I think, because finances might be a deciding factor. But these guys do actually do quite well if somebody's surgically going to intervene. I think if they have a truly soft palate problem, surgical intervention, if it's indicated, is the one thing that's going to help them lifelong. But I think a lot of what I'll be doing is similar to the previous case that we've been discussing, except that I would put a lot more power into the owner's hands, because this is a lifelong problem, and it's something that they would need to manage way more frequently. So I would teach them again how to use a nebulizer. Bulldogs are a little bit more challenging to get into postural drainage positions because they very often feel, I don't want to say claustrophobic, but they get anxious in those positions a lot quicker than a normal not brachycephalic type of breed. So I might alter my postural drainage positions a little bit, but I would definitely either show the people fostering the puppy or the owners the different techniques to help with secretion buildup. I would get the dog very accustomed to a nebulizer so that you can actually nebulize them quite frequently, and then make sure that their exercise tolerance and their breathing depth remains really well, or well developed, let's put it that way, because those are the things that we're going to try and prevent that secretion buildup, which will then lead to further problems like pneumonia, etc. So I think with those cases, I'd really get the owners involved. And if it's a rescue organization close to you, I would probably educate the caretakers or the foster staff how to manage this so that we can prevent it from becoming a secondary problem.
Thanks, Marinette. And McKenna actually asked a question. I'm going to put it up here so you can see. She said, will this dog be at a greater risk for pneumonia for the rest of his life because he suffered aspiration pneumonia as a puppy?
In theory, I don't think it's supposed to be, because it depends on how bad the aspiration pneumonia was as a pup, and how quickly they intervened and how quickly they treated it. I am answering it potentially a little bit more from a physio point of view than from a veterinary intervention point of view. So, but theoretically, no, it's not supposed to be a lifelong problem. They can actually recover quite nicely from this when they're young. I just think maybe with this specific case, it either maybe it was compromised in any case, maybe it came from a background that wasn't 100% ideal, and it wasn't treated initially. And I often think that owners can miss the subtle signs of not necessarily a dog struggling with pneumonia, but a dog that's got an underlying not such a great respiratory system. Because a cough here and there, they might not notice that it's a problem. And maybe the intervention waited a little bit long before they started treating it. Yeah. So in a normal aspiration pneumonia case, they should recover from it 100%. It shouldn't actually predispose them long-term for recurrent pneumonia. No.
Yeah, I think from a veterinary perspective, as long as they're treated appropriately, it shouldn't. And that's the main thing, and they should be. Okay, the next question is, have you ever worked with cleft pallet puppies, and how do they cope long term?
Okay, yeah, it's quite interesting, because obviously cleft palate puppies, if they pull them through that initial stage, they get to a point where aspiration and secondary lung complications is something that's quite a real problem for them. There is a very interesting Facebook group on canine fertility and reproduction, and the breeders and the vet intervention and the medical resources are great in pulling through those puppies from a young age. I've worked with a few young ones where the clefts weren't that bad. It wasn't 100% through the roof of the mouth, the palate, and with really good intervention from the owner where they're feeding them carefully, and regular chest physio where we get rid of some of the fluid buildup, we actually had quite a good outcome for these little guys. Obviously, some of them need surgical intervention later on, but when they go over into solid foods, and if you adapt their water intake a little bit, they do quite well. And the same thing again as with the bulldog puppies. If you just keep an eye on it to recognize when things are going wrong, to try and prevent it from turning into a bigger secondary problem, I think they can cope quite well.
Yeah, thanks, Marinette. The last question, and I think this is sort of just quite a broad question. How do we get our referring veterinarians on board for treatments? It's a great question. Not necessarily. I think that the question is in general.
Yeah, I think the cardio resp industry, if we look at it from a human point of view, is really, really big. And if you look at it from a research point of view, our intervention is really, really important. I'm unfortunately in an area where we don't really have a 24-hour ICU vet setup, but I think that's the area that I'd start trying to get the vets more involved, because they have severely compromised patients. So either something that is compromised post-surgery, or if you have some form of a systemic illness that's causing a cardiorespiratory compromise, those are the guys that I would probably start offering my services to see if we can actually make the patients stay in the ICU shorter, because at the end of the day, that's what we're focusing on. And I think if we're part of the team with the vets that makes that recovery process faster, they would probably buy into it. So I think those are the areas that I would start focusing on, is getting the guys that's in the ICUs better quicker. And it's actually I want to say easy. It's probably not the right words to be using, but if we can make their aeration better and we can make their breathing depth better, we will stop the buildup of secretions or prevent it as far as possible. And then that secondary complications becomes a lot less. So if you, for example, have a snake bite patient, or maybe something that had disc surgery and they're just really painful and they can't breathe properly, if we can start incorporating some form of respiratory physio post those type of surgeries, or just post anesthetic, I think we will make the recovery process faster. And I think vets believe in what they see is happening. If something's improving and they can see that it's improving, I think those are the areas that we should be focusing on. I also
Sorry. No, I was going to say, if you think about it, in human hospitals, I mean, physios are in every single ICU every single day, a few times a day. And I know that we don't obviously have physios in every single veterinary hospital, or it's only in the very, very large hospitals. But there's so much that physio can do for a lot of these patients, and without people that obviously have the expertise, they're not able to. These animals aren't able to benefit. So I mean, from a veterinary perspective, I was never taught anything about veterinary physiotherapy. I can remember, because I actually did veterinary nursing first before I studied veterinary, and I remember the very, very small thing on nursing, just about turning them over continuously, and then a little bit about just cupping them, like that, but really not a lot at all. So there's really a big gap, I think, especially in our critical patients, where the treatments that they could be having to really benefit them.
And the thing that I want to mention on that is our bird and our PEEP systems, where you kind of almost force air into the lungs to get that aeration better, which I think is really, really underutilized. So I think it's an area that we really need to start exploring, so that we can see the benefits of it. Yeah.
Thanks so much, Marinette. That's been really, really awesome, and I've learned loads.
Vet Rehabbers, for more information on how to take your career to the next level, go to www.onlinepethealth.com. Please don't forget to subscribe to my podcast so you'll get notified. I'm here every single week talking to vet rehabbers from all over the world, learning, and I would love you to join me. Hope you have an awesome day further. Cheers for now.